Research the cranial nerves involved in swallowing, which are 5, 7, 9, 10, and 12. Each of these cranial nerves have mixed functioning except for the hypoglossal, which is only motor. The trigeminal nerve is responsible for biting and chewing and sensation to the face and mouth. The facial nerve controls facial expressions and provides taste to the anterior two-thirds of the tongue, sensation in the ear canal and behind the auricle. The glossopharyngeal nerve supplies all the muscles of the pharynx that help with swallowing and provides sensation in the pharynx and tonsils, and taste in the posterior one-third of the tongue. The vagus nerve helps with movement in the neck, thorax, and abdomen, and provides sensation in the thoracic and abdominal region along with the intestines. And lastly, the hypoglossal, the only motor nerve, supplies the muscles of the tongue to help with speech and swallowing. The development of these cranial nerves they all become present in week 4, and the trigeminal is the first to appear. The trigeminal and facial develop from the mesencephalon, and the glossopharyngeal, vagus, and hypoglossal develop from the myelencephalon. The cranial nerves form through the neural crests, and once the neural folds fuse, the cranial nerves continue growing with support from the roof palate. Some of the pathologies that can result as damage occurs to these nerves are trigeminal neuralgia, which is severe pain in the face, Bell's palsy, where one experiences muscle weakness on one side of the face, glossopharyngeal neuralgia, which is pain in the back of the throat, tongue, and ear, dysphagia, which is obviously swallowing difficulty, an array of voice disorders, and dysarthria, which is weakness in speech muscles that cause a slurring or lack of rhythm during speech. Here's a list of some treatments to the previously mentioned pathologies. So for dysphagia, one can have an endoscopy where a tube is placed down the throat to stretch out the esophagus, allowing more space for the food to pass through it. There's also a laparoscopic helermyotomy, where an incision is done in the esophagus to increase the ability to push the food through. They can also have a stent placement in the esophagus where the food was previously being blocked. For Bell's palsy, one common treatment is decompression surgery, where the passage of the facial nerve is cut open to alleviate the pressure placed upon the facial nerve. For neuralgia, one can get a nerve block where they switch off the pain receptors in the affected area to assuage the pain and inflammation the individual is experiencing. For dysarthria, the primary treatment is speech therapy to strengthen the mouth muscles. And for voice disorders, patients usually undergo voice therapy where they are taught how to clear their throats and use their voices effectively. Some of the specialists for cranial nerve dysfunction are ear, nose, and throat specialists, which have extensive training in hearing sciences, nerve disorders, and balance disorders. There's gastroenterologists that help patients with diseases in the gastrointestinal tract and liver. Neurologists help patients with nerve disorders in the nervous system. And then there are the speech-language pathologists that can assess and treat communicative disorders. Assessment for the pathologies, the main assessment is the cranial nerve exam, which is a list of actions that the individual is asked to perform to see whether they have that ability or not. So for cranial nerve 5, they may be asked to raise their eyebrows, clench jaw, move the jaw side to side. Cranial nerve 7, show teeth, smile, puff cheeks, and differentiate tastes. Cranial nerve 9, test their gag reflex and swallowing ability. Cranial nerve 10 also tests swallowing ability, and the individual may be asked to produce different sounds, so testing the vocal cords. And for cranial nerve 12, they can protrude their tongue, move the tongue side to side, and push tongue against the cheeks. A few other assessments are dynamic swallowing study, where an individual will be asked to swallow different foods coated in barium to project moving images of their muscles while swallowing. There's also the endoscopy, where they place an endoscope down the throat, which will illuminate the esophagus for the doctor to easily examine. There's a manometry, where a tube in the esophagus reveals the nature of muscle contractions while swallowing, which the doctor can examine. And then there are CT and MRI scans that provide thorough images of the desired structure that shows the doctors any abnormalities in the nerves that might be creating a potential disorder. The last thing I'm going to be talking about is a recent advancement in assessing swallowing, which emerged in September of 2020. So this is typically done through an analysis of a video fluoroscopic study, or a VFSS, which is extremely difficult and time-consuming. A VFSS is a series of images of one's swallowing structures while swallowing different types of foods and consistencies. So this new method is a technology called a machine learning analysis that can automatically measure the swallowing reflex response time during the pharyngeal phase. The accuracy is between 97.5% and 98.2%, so it is pretty good and hopefully will continue in the future. Thank you for listening.